Hi, Dr. Alex Tagva, board certified neurosurgeon. Wanted to talk to you about something that's a little bit counterintuitive, which is the causes of back pain in athletes who participate in rotational sports. Sports like golf, tennis, pickleball, baseball, anything that really requires rotation. We sometimes get lulled into giving sort of generic advice for back pain, things like lose weight or work on your core strength. And it turns out that with rotational sport athletes in particular, some of that advice may not be specific enough. So, the first thing that is highly correlated with back pain in rotational sport athletes is lead leg hip mobility. So, that basically means how well the front leg, when you're hitting or throwing something, rotates, and especially internal rotation. So, why is that? Generally, when we're trying to, let's say, hit a tennis ball or go through a golf swing, we have to start sideways, and then at the finish of our stroke or shot, we have to be facing towards where the ball is going. And that requires essentially a 90-degree rotation. If our hips move well, most of that rotation happens at the hip. Unfortunately, if our hips don't move well, our back has to take over. And our back, given that there are a number of mobile parts and vertebrae, has more degrees of freedom. So it's able to take over that rotation. The problem is our discs and our facet joints aren't really made for that. So what happens is when we use our hips incorrectly and we use our back to take over, we put torsional strain on the disc. And easy way to start fixing that is by doing things that work on internal rotation of the hips. Biggest one is simple things like 90-90 stretches. So that's where you sit down on the floor and have your knees and hips at a 90-degree angle. You have to try to sit up straight and then rotate one side and the other. The other thing is using bands to improve the strength of the internal rotation. Now, with any movement or stretch, one of the most important things is not just doing the stretch and building the mobility, but it's also integrating it with the sport. And I think what it really requires, especially for me as I get older, is really intentional practice at slow velocity before integrating it into a sport. So for tennis, for instance, so I'm a ex-tennis player. I would try to do some slow swings, making sure my hips are moving, making sure the strain's off my back after I do some of these mobility exercises. I think before you hit the golf course or hit the tennis court, doing some warm-ups and some shadow swings probably also helps. Once you integrate the motion, then you can slowly build up speed till hopefully you're playing full speed again. Second thing that is highly correlated with back pain in golfers especially is short hip flexor length. So hip flexors basically attach your spine to the front of your hip and assist in hip flexion. The problem is if your hip flexors are short, what it tends to do is it tends to rotate your pelvis downward, something we call anterior tilt, because the cable that's pulling on your spine and connecting it to your pelvis gets shortened. The problem is when you have an anterior tilt of your pelvis, it creates a translational shear. So gravity is pulling down on the front of your spine. And when you do that, it creates a translational shear across your discs. Now, there's easy ways to work on this too. One common way is something called a couch stretch. And really key part of this is to maintain your spinal alignment, and actually flexing your glutes a little bit on the side you're stretching is really helpful for that stretch. I find personally that engages the hip flexor while taking strain off the back. Again, if any of these stretches, including the 90-90 stretch or stretching for your hip flexors, causes back pain, circle back around, see if there's modifications you make, engage a physical therapist or personal trainer, because you don't want to damage your back or reinforce pathologic movements when you're or compensatory movements when you're doing these activities. Finally, third thing is lateral bridge asymmetry. So essentially what this means is when you do a lateral plank, whether or not both sides are equal. If your weak side is 12.5 seconds shorter than your strong side, then you have a meaningful asymmetry that's correlated with back pain in athletes. Easy way to work on this is doing lateral bridges, but make sure you focus more on the weak side. And what you should do is work on the weak side, and you can do work on the strong side as well, but you never want to go longer than the weak side. And you want to try to get up to about 45 seconds on both sides. When you do that, you can increase by about 5 seconds per week. Building that symmetry is important because, especially if you have a dominant hand, the muscles on one side start to get stronger than the other, and that can pull your spine into a scoliosis or apply lateral compression on the discs. There's a name for it that's been in the neurosurgery literature called traumatic discopathy. But it's really what it is a crunch effect on the lateral edge of the disc. With golf especially, you end up in a fair amount of side bend at contact. Tennis also, especially on the forehand side, we see people crunching their obliques on their dominant side to hit the shot. So those motions can apply repetitive stress to the disc. Love to hear your comments. If you have any questions about what athletes are most common in my own practice and the advice I give them, I'd love to hear that in the comments. Otherwise, thank you. I hope this is helpful.